Olá, esse é o Poder Entrevista. Eu sou Paulo Silva Pinto, editor sênior do Poder 360. Vou entrevistar o médico geriatra norte-americano Scott Sherman. Ele é professor da NYU, a Universidade de Nova York, nos Estados Unidos. Uma de suas áreas de pesquisa é a cessação do fumo. Professor Scott Sherman, thank you for this interview.
Thank you very much for inviting me to talk with you.
Agradeço também a todos os web espectadores que assistem este programa. Essa entrevista está sendo gravada no estúdio do Poder 360 em Brasília, em 6 de maio de 2024. Para ficar sempre bem informado, inscreva-se no canal do Poder 360, ative as notificações e não perca nenhuma informação relevante. A entrevista a partir de agora será em inglês. Professor Scott Sherman, I began this interview asking you if vaping can be an effective tool for quitting smoking.
Yes, in the US, this has caused a lot of controversy, but in other countries, it has not been so controversial. And if you look at the science, it's very clear that vaping can help people quit smoking. And in fact, it's more effective than some of the existing treatments.
Your research, as far as I know, encompasses other actions for helping smokers to quit smoking. Other actions such as messaging smokers. How can it help?
So, I've spent the last 25 years or so looking at ways within healthcare that we can get people who smoke to quit, because we already know that quitting smoking is pretty much the best thing a person can do for their health. Smoking is the leading preventable cause of death in much of the world. And we have many things that work, including medications, counseling, and even text messaging. But I've been fascinated over the last 5-10 years with the possibility of whether e-cigarettes are also something that clinicians should be using to help their patients quit smoking.
You said in the United States, vaping is still controversial. Why is it so?
I think it's historically that when the rates started to go up, they started to go up dramatically among teenagers and young adults. And people appropriately went crazy. There was a lot of marketing that was targeted directly at teenagers, using social media and other forms. And despite companies saying, "Oh no, we're not marketing it to teenagers," you look at one ad after another on the internet, and it very clearly was marketing to teenagers. So the rates went from very low to all of a sudden a third of high school students were using e-cigarettes and vaping. And everybody got appropriately tremendously scared that there was worry that 50 years of progress in tobacco control would essentially go up in smoke. And so people looked at, so the initial reaction was, we have to stop this immediately. I think if the government and the federal and state governments had done immediately what we knew worked for keeping cigarettes out of the hand of teenagers, a lot of that initial rise would have been blunted or stopped. Because public health, we know what works in keeping cigarettes out of the hands of children, but we weren't doing that yet with e-cigarettes. So that was what fueled the controversy, is that everybody was all of a sudden tremendously worried that decades of progress would be lost and that a generation of teenagers would become hooked on nicotine right when it seemed like cigarettes had been going away more and more. And unfortunately, the casualty with that is nobody really talked all that much about the extent to which e-cigarettes or vaping might be a solution for in the US, the 35 or so million people who currently use cigarettes.
As far as I understand this controversy, and please correct me if I'm wrong, the concern is that vaping is attracting young people who wouldn't smoke cigarettes, traditional cigarettes. What is your assessment of it?
So it absolutely did. It was attracting a lot of young people who weren't smoking. So when I think about giving an e-cigarette to one of the people that I see in my practice who currently smokes, to me, that's a harm reduction approach. I know how much harm cigarettes will do to the person, whether it's emphysema or heart disease, and I'm hoping that e-cigarettes are a less harmful or alternative. On the other hand, when I take an adolescent who isn't using any form of nicotine and they start using e-cigarettes, that's not harm reduction. That's just harm. And there's both the concern that they'll be harmed from the e-cigarette itself, and the other concern that this will lead them to that they'll transition from e-cigarettes to cigarettes, and then we're back where we started.
So, what could be done to avoid people who wouldn't smoke in the first hand to consume e-cigarettes or vaping?
So, in the US, what led to dramatic decreases in the number of teenagers and young adults who smoke were a few things. One is that it was against the law. You couldn't buy cigarettes initially if you were under 18, and then it became if you were under 21. And it wasn't just that that was the law, but nobody was enforcing it. Many states and local regions started to put in place what they call secret shopper programs, where they would send 17-year-olds into a store to try and buy cigarettes. And if they were able to buy them, then the store would be their ability to sell cigarettes would be taken away because they were selling to underage people. The other equally big thing I would say is that the culture changed and it just became not cool, to put it in those terms, to smoke anymore. Part of that is fueled by advertisements by what used to be the American Legacy Foundation and now is called Truth, ones that basically just made cigarette smoking not appear to be glamorous. Basically pointed out how to teenagers and young adults how really what was driving this was a desire for profits on the part of the tobacco companies, that and that they were being manipulated. And what teenager likes to be manipulated? So I think it was two things to answer your question. It was making it more difficult for teenagers to buy cigarettes, and a lot of things that led to the culture around smoking being changed, so that it just wasn't what kids did anymore.
When it comes to flavors available in vaping, do you think there should be any restrictions?
That's a really interesting question, because the people who are very concerned about adolescents taking up smoking, I think rightly point out that flavors make it more attractive to teenagers. That here's this kind of cool product that doesn't taste disgusting. It tastes kind of cool, like a mango or a watermelon. And so it makes it easier to get started. And that I totally believe. At the same time, all the data that I was able to look at about adults says that adults who smoke also like flavors. And that by taking away flavors, as we did in the United States, we are probably helping to prevent teenagers from starting using e-cigarettes, but we're also probably making it harder for adults who smoke to use these to quit.
What other restrictions should there be in vaping to prevent teenagers to use it?
So clearly, I think all the restrictions that apply to cigarettes probably should apply to vaping as well. In New York and in many parts of the United States, you can't smoke in office places, restaurants, bars, and that ought to apply to e-cigarettes too. First, there is a concern that the reason those laws came into place in the first place was that people have a right to smoke, but if I'm sitting in a restaurant, the people smoking at a table next to me are hurting me. So I have a right to not be harmed by their smoke. And it's still not clear the extent to which vaping harms people nearby, but it's part of the whole public health tobacco control package. That by making it a bit more difficult to use the product, you are more likely to keep teenagers from starting, and you're sort of shifting people towards not being a tobacco user or a nicotine user in the first place. The other thing that affects teenagers a lot is price. And this is a more nuanced answer because it depends. The price, really, what it matters is not just the price of e-cigarettes, but the price of cigarettes too. So if vaping becomes really expensive, but cigarettes are cheap, teenagers are probably going to shift back towards cigarettes and vice versa. So you probably want to tax vaping or e-cigarettes somewhat because the more you raise the price, the less people use it, especially young adults who are more sensitive to the cost of it. But you also want to do that together with the price of cigarettes.
Now, one question that is behind the whole e-cigarette thing is one thing: is nicotine bad for health?
So nicotine itself is not what causes the vast majority of problems within smoking. It is the carbon monoxide that you get when you burn the nicotine, burn tobacco, and the tar and thousands of other chemicals in there. One reason we know that is, as a physician, I have at this point prescribed thousands and thousands of nicotine patches for people over the years, nicotine gum and lozenges. And those are all reviewed by the government here, by our Food and Drug Administration, and found to be effective at helping people to quit smoking and generally safe. So it's not the nicotine that's killing people. It is the way that it's taken. And so e-cigarettes hope to get around that by you're not burning it. The temperature. It's a different process, so it doesn't generate carbon monoxide. And
there's no combustion.
Yeah, you're aerosolizing it, and it doesn't generate those other thousands of compounds. Now that said, there is still the risk that there are compounds in e-cigarettes like propylene glycol, which gets broken down when it gets vaporized, and we're still looking at what the long-term effects of those are. No, and this has been one of the arguments in the field as well. You have no idea what this is going to do to people 30 years down the road. And I agree completely. I have no idea what's going to do 30 years down the road. On the other hand, I know that cigarette smoking is about one of the worst things that you can do in health. And so it would have to be worse than that. And we haven't seen those signs so far. So nicotine itself is not the problem. And the FDA here in the US, the Food and Drug Administration, talks about a spectrum of harm for nicotine, with cigarettes being the absolute worst, then e-cigarettes probably being here, and nicotine replacement being here, and not smoking at all being, of course, the least harm.
Does it make sense to ban vapes while cigarettes are allowed in a country? That's the case of Brazil. That's why I'm asking you that.
I tend to think it doesn't because, everything, like I mentioned earlier, these have been more effective than nicotine replacement in getting people to quit smoking. I have colleagues who don't necessarily want to see that, but there's been study after study pooling together all the science, and they all show the same thing at this point. These are effective at helping people to quit smoking. At the same time, the US is a great example for what can happen in an uncontrolled market where all of a sudden you have a third of young adults using this product and harming themselves. And who wants to see that in a country? I've been countries where they are illegal, but it's still very commonly used because they're very easy to get to bring in your suitcase and things like that. And so I'm not sure that completely banning them doesn't always work completely because people manage to get a hold of them. But it has to be done carefully for the reason I mentioned, that you don't want to cause more harm than good.
When you say e-cigarettes are more effective than other tools, how more effective they are? Can it be quantified?
Well, one of the big studies came out about 5 years ago in one of the leading journals, the New England Journal of Medicine, and a gentleman in London did a trial where they randomly assigned people to either e-cigarettes or nicotine replacement therapy. And at the end of a year, the rate of being off of cigarettes completely was 19% versus 13%. So that was a sizable difference. And in sort of more general terms, I think of all of the different types of nicotine replacement that we have kind of double your chances of quitting. And e-cigarettes have been consistently shown to do more than double the chance of quitting when you look at these studies where they compare the two. So it's hard to put an exact number on it, but this the one study where they pool together all the available science to date has just gotten more and more clear that this is not open for debate anymore. They say that they are more effective. There are other medications out there, like in the US, varenicline triples somebody's chances of quitting. And I haven't seen the extent to which e cigarettes would compare with that. I also look at it pragmatically as that I am always looking for ways to get my patients who use tobacco to smoke. And I'll sort of take whatever I can get, even something that may still have some risks itself, but is substantially less harmful. And so I tend not to obsess as much over, it does nicotine replacement double it, and this make it 2.4 or 2.5 times. They both work. And the biggest benefit for somebody is getting off cigarettes completely. But what I've liked about the possibility of e-cigarettes is that it's an immediate solution. Prevention, like keeping kids off of cigarettes, will help us lower death from tobacco 30, 40 years down the road. But e-cigarettes have the potential to lower deaths now.
You'll be attending the e-cigarette summit in Washington, D.C. next week. What can we expect of it? What are your expectations of this meeting?
I went in person a couple years ago, and then watched by video last year, and I just thought it was fascinating. There are a wide range of talks on the topic. Obviously, this is not going to the people who are absolutely vehemently opposed to e-cigarettes, because they wouldn't agree to come there in the first place. But it is, I thought, a really nice wide range of talks on e-cigarettes, ranging from the health implications to the policy to regulations, and people's attitudes towards them. I'll be giving a talk on a demonstration project we did, a pilot study, where we took people who smoke who have diseases related to smoking, like emphysema or heart disease or arterial disease, and randomly assign them to either e-cigarettes or nicotine replacement. Because that's, again, going to the people who are getting harmed right now from cigarettes. So if I'm going to see a benefit, I'll probably see it the soonest in them.
Professor Sharman, is there anything else that you would like to comment on?
No, I really appreciate your raising this issue. As you can see, it's easy to get me excited talking about this. I've spent 30 years doing everything I could to help people quit smoking. My patients one-on-one, the healthcare system I work in, where we put in place policies that got hundreds of thousands of people to quit smoking. And I think the biggest thing that is we've heard a ton of reasons why e-cigarettes are potentially bad, adolescents, teenagers. But it's very clear that we still need more science on the extent to which these can benefit people. And if they do, how do we do that in the best way without harming others? So thank you for the opportunity to talk about that.
E chega ao final essa edição do Poder Entrevista. Professor Scott Sharman, thank you very much indeed for this interview.
Thank you.
Agradeço também a todos os web espectadores que assistiram a este programa. Esta entrevista foi gravada no estúdio do Poder 360 em Brasília, em 6 de maio de 2024. Para ficar sempre bem informado, inscreva-se no canal do Poder 360, ative as notificações e não perca nenhuma informação relevante. Muito obrigado e até a próxima.
Poder Monitor. Acesse agora e ganhe 30 dias grátis.